Hi, good afternoon, Miss Anima Rawat. Can you please let us know who all are there from Dell and Tata Trust who are waiting in the attendees so that we can make them panelists straight away?
Oh, so give me a minute, I'll figure out.
Hello? Okay.
Sir, can you move Akanksha Tikku and Mr. Vijay to the panelist list?
Okay. Vijay B. Sharma, right?
Yes,
Okay. Vijay B.
and
Sharma
Akanksha Tikku.
and Akansha.
Yes.
Okay. So Akansha or Anima, is there anyone else left?
That is all, Dr. Anwar. I think should be fine.
Okay. We'll wait for I think 5 more minutes and then we'll start.
much, and I want to. Are you attending a session?
Yeah, I'm given. No.
Hi, good afternoon, everyone, and I would like to warmly welcome all the attendees from different states and union territories of the country. Today, we are joined by nodal officers of CPHC, nodal officers of NCDs, nodal officers of CP, as well as state consultants, district nodal officers, and also the PHC medical officers. So we have an overwhelming almost about 2,500 participants already who are attending this meeting. 1,600 of them are attending through YouTube and around 400-500 are attending through the WebEx. So this is a very important orientation which we have planned, and in this orientation we'll be walking you through the new line list feature we have which we have enabled in the CPHC NCD system. So I would like to formally start the meeting by inviting Dr. Balasubramaniam sir, advisor CPCPHC, for his opening remarks. So a very warm welcome to you, sir.
Come to each of the participants from the different states and union territories of the country. I'm really happy to see such a large number joining at a very short notice. And this really says how important the IT functions are in today's world, and how eager that each of us as functionaries at different levels, at the state level, at the district level, at the facility level, are in terms of utilizing these services. Now, first and the foremost thing I would like to clarify that this is basically a orientation program and it's not a monitoring program of any one of you. Second, I would like to also highlight that data has to be used by the end user, and that is the person who actually inputs the data. So it is like, if I cook, I should be able to eat it first. If I am not able to palate what I've cooked, there is no way that others would enjoy what I've cooked. So in that context, even in case of data, if your input is not actually providing value to you and your services and ultimately the citizens that you cater to, that data is useless for any other level, whether it's block level, district level, state level, or national level. The other point that I would like to emphasize is, when you have numbers on your desktop or on your mobile phone, it's a very empowering tool. The reason why it empowers you is it helps you to understand where we are, what you intend to do, and it also guides you how you would be able to move forward, because you know what is the gap that you have to address and what is the periodicity in which you have to accomplish it. So if these things are understood by each one of us, it will be of immense value to the service that you deliver, and ultimately it transforms the health scenario of the area that you serve and the health outcomes that you derive in your area and contribute to the national level sustainable development goals. So, in this context, today's effort of appraising you about the various features that are there in the comprehensive primary healthcare non-communicable disease app as well as the portal would be of immense value, I suppose, to each one of you when you start working on the field. I have been visiting various states and union territories. Even yesterday, I was in some facilities of Goa state. What I realize is that the leadership at the primary health center, which is the medical officer, the leadership at the subcenter, which is the CHO, by themselves are not conversant of all the utilities of the app. If we actually focus on it, in fact, one example I would like to give. I went to a primary health center and asked them how many hypertensives visited you here and how many of the hypertensives are there in your area, which is catering to 40,000 population? The spontaneous answer is, I got 20 hypertensive patients who attended my clinic today, which is beautiful, so that you have such a substantial attendance to your center. However, as a primary healthcare physician, my interest is not only on those 20 patients, it is also that who else has been left behind in the community that I serve. If my prevalence is 10%, and I have got nearly 483 patients in that PHC, that as per the opinion that they got when we actually looked at the data, we realized only 20 patients have come. Then the next point that we did was we actually asked them to look for the line list, which is available sub-center wise, PHC wise. So once we went into the line list, we realized in one sub-center itself, there were 26 patients, out of whom 3 patients were not due for follow-up as on September 12th. But there were 23 patients who were due for follow-up because the line list gave the follow-up line list, pending file list. 23 of them have not even reached when their due date was as early as 30th August. And if we actually look at that data, it is not about pointing fingers at anybody here. Immediately, the medical officer would have be empowered with the data to call out to that subcenter CHO and say that there are 23 patients who have not taken drugs in spite of actually having the due date crossed, which necessarily mean that if they follow up those patients and able to ensure adherence of the treatment by those patients would have good control of their hypertension, and consequently their problems related to hypertension, whether it's a papilledema in the eye or a heart problem or a cerebrovascular stroke, are all avoidable on one side. Quality of life improves on the other side, and the net result of all these efforts would be that patient and person would survive at least 10 years longer. Don't you think, as a leadership at the primary healthcare team, you would be excited to see every person in the community that you serve actually lives 10 years longer? This is the benefit of looking at data, looking at reports of the data, using it appropriately to ensure better coordination amongst your own team members and service to the community at large. I'm sure today's session will give you insights into the innumerable permutation and combinations that are possible, equipping you, empowering you with information which you would be happily use for planning, for delivery of services, and also assuring health outcomes in your area. So do give us feedback in terms of any sort of challenges that you find in the app. We are here to simplify the app further. In fact, in the last 15 days, 80% of the field items have been removed by the Dell team in coordination with the NCD team. I'm sure these sort of redundancies can be removed, made every app very efficient as long as you use it and you give feedback about what you want next out of that data system. I'm sure this session would help you do that. I also add up one thing, because there are so many people who have joined over here, that we are eagerly looking forward to simplify the effort that you actually look at, not only in the using the CPHC-NCD app, but there are multiple apps being used at various states and union territories by the same facility, by the same service provider, which is burdening people on data entry. This includes, for the same hypertension, a simple app as well as the CPHC-NCD app. The ministry has taken a call, fixed a deadline of October 31st for transitioning all simple app into the CPHC NCD system, which would ensure that there is one system that will work. However, ministry has also taken cognizance of the value that the simple app brought in till now, and hence have taken incorporated all the important, essential, and valuable components of the simple app and incorporated the same into the CPHC NCD app, so that the essence of the CPH simple app is not lost. At the same time, the burden of duplicated effort by every healthcare provider is removed. I'm sure all these efforts go well in alignment with making everybody's life simple, at the same time everybody's service very valuable to the citizen. So we look forward to your engaging conversation today and subsequently too. So all the best for the training program or the orientation program that you are now indulging with for the next couple of hours. Thank you very much.
Thank you very much, Dr. Balasubramaniam sir, for comprehensively walking us through the importance of both data monitoring in context of improving the indicators as well as in the decision-making process for the continuum of care. So, a couple of announcement before we start with an orientation. The first announcement I would like to tell that the link which have been shared, it has it's separate for the attendees and it's separate for the panelists. So the questions definitely will be more than happy to address, but you can always raise your hands at the end of the session once the session are over, and those who have raised their hands will make them as a panelist so that they will be able to speak with the speakers directly. You can also type your questions in the chat box, and our panelist team will be very happy to address those questions straight away. Uh, I've been seeing some chat queries that we are facing an issues with the internet connection. So I would like to let you know that the entire session is being streamed right now on the YouTube channel as well. So if you are having the bandwidth issues, I would like to request you to shift to the YouTube channel, where even with your low bandwidth, you will be able to hear the session very comprehensively and without any issues. So without further ado, I would now like to welcome Mr. Vijay Sharma and his team from Tata Trust to start with the orientation. Over to you, sir.
Yeah, thank you, everyone. Am I audible?
Yes, sir.
Yeah. Thanks a lot, Dr. Anwar, and initially Dr. Bala for giving a, detailed description and like scope of this whole line list sharing with the states, how it is going to impact, and how beneficial it is, as we all know, but it has been elaborated very, very effectively. So I think I can straight away jump to that. I'll share the document, which I think all the states must have received already. I'm going to share the screen. Is my screen visible?
Yes, Mr. Vijay.
I believe all the states must have received this document from ministry, right? So I'm just referring to the same document, and I'll walk you through this document, and then I'll give a hands-on session also, that how exactly are you going to download the data. And first, just a description, basic brief description of the data. This data is having like 15 columns, having screening status for 5 diseases. And this data is up to PHC level. Fine. So shall I start with the document one by one?
Yes, sir.
Yeah. So as we have mentioned in the document, that central server, like in state central data center, will have all the line list up to PHC level of all the states. So this approach we are following is like state should have access to all the districts, and district should have access to all the PHCs within that district. So if we log in through state specific login, we have provided actually credential to every state. If we log in through state, the state logged in authority should be able to visualize all the districts, and within districts, all the PHCs within that district will have that line list data available. They can further distribute amongst districts, or they can straight away give the credential to district specific people who will have their specific login, and they will have access to district specific data only. Further divided into PHCs, like all the PHCs of that district will be visible for the district login, and all the districts for that state will be visible to state specific login. So mostly I think, I believe all the users, like end users are there, so they will have district specific login. So they can access data for all the PHCs coming under that district. Okay, so PHC wise, we have distributed, I mean, given the line list of the data, which will have the individual details. Like I'll brief you in detail. I mean, I'll give the details also, like what exactly, what the data exactly are we providing. But this is the whole hierarchy. Like central servers will have all the data, then state specific will have state level data. All the districts would be visible to state specific login. Then district will have access to all the PSCs residing within that district, and that way. Then further PSC wise, further, I mean, up to subcenter, the data is not there, but PSC, I think monitoring should be enough to begin with. Some basic assumptions we have made, like you should have a proper like internet connection, because you have to log into central FTP server. From there, you are going to download the data and then extract it. The other thing is you should have received username and passwords for respective districts or states, so that you should be able to extract and like decompress the data. Data is provided in CSV format, like that is Excel format, because some PHCs have huge data, so Excel sometimes is non-responsive. So you need to just put the extension at .csv, and the file should be visible. There are some prerequisites, like we have actually to save the space and to encrypt the data, we have like zipped it. As you know, like the data set is huge. If we consider whole country, there are thousands of PHCs actually. So what we have done is all the files are compressed in zip format, and for that we are suggesting to install this particular software, which works on Linux and Windows both. So this is a very basic open source software, free for download to everyone. I have given the link also, and I can just show you. In browser, you need to type this 7zip.org, and you have to click first link if you are using 64-bit Windows operating system, which is usual. I think this is the 90% case. Simply download, and you should be able to simply press install, and it should be done. This is just two-step process. I believe everyone is computer savvy. If anyone has any questions about this, please keep noting, and in the end we will take it up. This is just two-step process. Just download the software and just install it. That's it. The next thing is this is the central FTP server URL, which you have to open. It should be given to every state, every district. It should be sent through ministry. Everyone should have these credentials and this URL, so as to download the data. So this is, I mean, nothing to brief. This is simply you have to copy this link, right? And you can simply paste it here. I've already logged in. I'll just log out. See, same URL I'm typing here and entering. You'll be presented with this username password prompt, where the username password you must have received from ministry, and you need to put in the password. If it is a district password, I mean district level credential you are logging through, then you should be able to visualize all the PHCs within that district. If you have a state level login, you should be able to visualize all the files within that state. So I have created a sample user. It is a district level user, and this is just for, I mean, just a security, that this is not an automated or brute power. I mean, someone is trying to log in through command or something. So just to ensure this is a correct, it's sort of a captcha. 8 plus 10, you need to write 18 and just log in. As I told you, this is a district level login, so it should be presented with only one directory, which will be the name of that district. Like I have created a sample district, so sample district will be visible here. And if we click further, then we'll see the file. I mean, it is a PHC. There can be like tens of PHCs which will be there. And if you just move the mouse over and you will be seeing this download link. You click it and the file will be available. I'll just show you actual one. Let's say I have logged in through J&K. See, I have logged in through a state login, right? If I click on Jammu Kashmir, it is giving me list of all the districts within that state. You can see Kupwara, Badgam, Punch, Rajouri, all these are districts. And within the district, if I click, I can see further PHCs, if there are any. But I think we should stick to the district login first. Why? Because most of the people will have access to that district directly, and the state, it would be very, very difficult to manage at state level, because there are like thousands of PHCs in few states where, I mean, there are 3,000 plus PHCs actually in UP, because districts are very huge. So it would be difficult to manage if we, collect the data at state level and distribute it further to districts, and they further distribute it to PHCs. So there will be 3 layers of communication, and there's some gap is ought to happen. So better is that we should give district level access, and they should download their district specific PHCs data and then distribute it to respective PHCs. So I'm just logging in through Kupwara. See, these are all PHCs actually. We don't have credentials actually, so we will not be able to display everything. So what I'll do is I'll just stick to that sample data and I'll show you the process, and I'll also come back to the document. I just showed you that this is the URL from where you are going to open that login page. Same thing we are talking about here, like this is username, password, and some security. You will be prompted for username, password. Please enter the required credentials and should be able to view respective directories, right? As I've mentioned already, that state will have access to all districts and district will have access to all PHCs within that district. I'm reiterating again and again. So this is what I just displayed. Like this is a district specific login, and district is going, this district directory is visible to that login. Now coming back to that, the next step would be, I have already shown you that download will be visible as soon as we click on this. I'm sticking to the sample district. I'll click on this. This is actually a PSC. Whatever, file you see within a district with the 7Z extension, these are all PHCs, and the PHC name will be visible, which is exactly matching to the metadata, or you can validate it in the admin portal also. It is just a sample data because this is line list data. I'm not going to display here. So I've just chosen sample demo. Fine. If PHC name is ABC, then it would be like abc.7z. There will be multiple PHCs and all the names would be different, and you should be able to easily identify what PHC's data I'm going to download. So simply clicking on download, I should be able to access the file, and I can define where I'm going to store it. I'm storing it on desktop for now. Coming back to the document, as I told, extracting downloaded compressed files of PHCs to CSV format. Now what we have already shown is extracting downloaded compressed file. So download has already happened. We need to extract that file, right? It is a 7Z file. As I already told you, it is a zipped compressed file. This is the file we downloaded. My screen is visible, right? Please correct me if anything is there, problem is there.
Yes, sir. It's visible. You can continue.
Okay. So this is the file, which is the end product actually. At what level the data would be visible. This is the Excel file actually. But right now it is in compressed form, and it is password protected as well. And these passwords will be communicated every district people through state team, and we have already shared the respective passwords for all the districts with the state team. So if you are able to download the file for extraction, you need to simply, I have already given the process also. You simply see 7Z extract files. All right. In the document also we have written, this is 7Z file, 7-zip extract files, right? And then it will prompt for a password, which will be given by state team to all the PHCs. If you distribute the files to respective PHCs, then you should also provide them the passwords to open it. Otherwise, it will not be opened. First level of security would be this password, right? First district will have to have access of this password. This is the first level of security. Once we are downloaded the file, but again you will be prompted for a password which will be given by a state team. So I'm just going through this. Right click on this 7Z extract files. Now it is prompting for password. That password will be available with the state team. Just typing it. See, you will be presented with the same name directory. As you must, I mean, most of us has used WinZip, right? So if we extract a file, a directory is created and you will be able to see that directory. It is simply, I mean, again, another tool actually. It's open source, works fine with Linux, and the compression ratio is also very good. So that is why we have used it. You simply right click, extract files, and the directory will be made. You open the directory, you can see sample demo data. This is the final file which we are actually looking for. But in the document, you must see that I have put a note there that once password is entered, the file will be downloaded, but doesn't have any extension. Fine. This is again a security sort of. For viewing the file in Excel, you need to add .csv. So if you want to open it in Excel, why CSV? Why? Because sometimes PHCs have huge data and Excel sometimes crumble under, like if a huge volume of data is there to be opened through Excel, sometimes gets stuck. So better we just simply click on it or right click, rename, and put extension as .csv. That's it. Now the final sample Excel file is available, which will have line list data of that particular PHC, having all 5 disease screening status mentioned against every individual with contact number and all. Family contact number also. I'll just open this file. Although it is not the actual file, but it will give you some idea. You press yes simply. This is the file which you will get for that PHC. This will be the whole hierarchy. First is PHC name, subcenter, village name, individual's mobile number, family contact number, age, gender, Aadhaar ID already generated, address, and then all 5 disease screening status. If pending screening is there, you can actually follow. So this is the first report we have implemented to begin with. That is the final data which you are going to get at PHC level. And all the individuals will be there. Like if 10,000 are there under that PHC, all 10,000 line list data will be available with status of screening status actually. I've given basic description in the document also. I'll go to the document. After extracting the file, you are able to access the CSV file at PHC level. There are some frequently asked questions. So I've already actually covered, is my data secured? Yes, we have put actually double encryption there. And format is already attached. What format is available? I have attached it actually in below. I'll cover that also. Will individual district logging state will be able to read data of other districts? No. If we are logging through one district credential, you will not be able to see data for any other district or any other PHC of other district. But if you're logging into state, you should be able to access the data for that state only, not any other state. So that is additional, security. If you still face some issue, you can actually contact us through mail or reach out to any Tata Trust or Dell coordinators within state. You can directly reach out to our L1 team and L2 team. I think through Tata Trust coordinators. And these are the fields which we are covering in that line list report Excel file. It is very, very simple actually. So everybody will simply understand through column headers itself that what exactly is PHC name. That is the PHC where individual belongs to, right? Same way, age, gender, ABA all are like very, very common. So we should be able to understand it very, very easily. And then the 5 diseases screening status is there. Screened, not screened, and that 3 statuses will be there. I'm not actually displayed whole data, but once you actually download the data, you should be able to identify and make actual use of it. Okay, I think document ends here. And we have already downloaded a file, extracted it, and used 2 passwords. First for FTP login, and the other one is for this file extraction, that zip file extraction, the another password. I'll also show you the file which should be shared with the states. This is the file where first screen will have FTP login details for all the districts. Right? So state should be actually distributing this Kupwada's district's username and password will be there in the file, which is the file is itself password protected. I'm just showing a sample file. So what state can do if they don't want to, like if it is a huge state and districts are many and the data set is huge, state may not be able to manage completely. So what they can do is they can distribute district wise login credentials to all the districts like this, and then district will log in through their respective logins. They will have access to all the PHCs within that district. So that is what we can do. Like we are distributing the work and managing the flow better way. This one is for FTP login. FTP is this one, this page, FTP. Fine. File transfer server, central FTP server. Then this is another one which will have districts file extraction password. All the PHCs will have the same password actually. So districts will have access to that password and they can distribute to PHCs. Once they distribute, like district A will have 10 PHCs, they have 10 7Z files, right? So what they will do is that they will distribute these 7Z files to all 10 PHCs. But for extraction, the PHC will need a password which district will give to the respective PHCs, so that they should be able to download. Downloaded file is already downloaded by district. They have sent it to a PHC, but PHC will not be able to extract. So they will need a password, and that password will be mentioned here in the file extraction details. All states have received this Excel having 2 sheets. First is FTP login, second is file extraction. And you should actually, the state should make sure that this file is all the time protected. It is already password protected, but it should not be distributed among districts or PHCs. But specific district or PHC level credential should be shared to the authorized personnel of that district or that PHC. I think we have covered it. Dr. Anwar, anything else we should cover, or any questions we can take up now?
Thanks a lot, Mr. Vijay Sharma. I think there is one more because Dr. Balasubramaniam told us 2 important things. That is, one is we are also working on simplification of CPHC-NCD application, and the second thing we are also because there is a lot of duplication of the entry formats in certain states. So we are also working on those. So I would now like to invite Akansha to basically show a short demonstration on what we are currently working on. Basically, sir told that we have removed almost 80% of fields for that PHC MO application. So basically, over to Akansha to just to show an overview ke how much simplification we have done so far. And after that, probably we'll move forward with the questions and discussions.
Yeah, thank you, Dr. Anwar.
Thank you.
Thanks, Vijay. So, as Dr. Balasubramaniam sir mentioned, we are right now undertaking a process for simplifying the CPHC-NCD application for medical officers. The simplification exercise is being undertaken in consultation with the ministry, officials from DGHS and NHSRC, as well as collaborators from WHO and IHCI team. So the simplified app, I will play a short video just to give you a brief overview of the current version of the simplified app. The app will be released and made live in production by next week, and we will send the necessary communication once it is live. Please give me one moment. I'll just share my screen. I hope this is visible.
Yes, Akansha.
Okay, I'm just going to play this.
The National NCD program has a new, improved CPHC-NCD solution. It has been upgraded to a faster and easier version that makes managing NCD patients a smooth, pleasant experience. The doctor logs into the app with password and a CAPTCHA. The doctor can begin enrollment by first checking that the person isn't already enrolled. Enrollment process has been vastly shortened to capture just 5 fields: name, gender, age, mobile number, and address, and can be completed in 15 seconds. The enrolled individual can now be examined by the doctor. On entering her blood pressure, the system will recommend a diagnosis based on the built-in Government of India protocol. On selecting the diagnosis, the treatment can be prescribed by choosing the medicines from the list which follows the IHCI protocol. The list of medicines is configurable, and medicines are state-specific and disease-specific. This whole consultation can be completed in under 20 seconds. If a patient walks into the PHC, the doctor can search for the individual by name, phone number, or ID, or simply scan the Aadhaar ID to pull up the patient's record. In the follow-up section, the vitals are entered and the medicine can be repeated or changed as needed, all in under 15 seconds. The doctor can check the dashboard at any point to get a full view of the work done so far and what is remaining, starting with people enrolled, screened, referred, and under treatment. The line list of patients who are overdue for their follow-up can be seen by clicking on the button. CPHC-NCD, helping control NCDs one click at a time.
I think we can move on to the questions now, Dr. Anwar.
Thanks a lot, Akansha. So if anyone have any questions, any suggestions, or even criticism with respect to ANC line list generation, we'll be more than happy to address. As of now, we will not be able to ask questions or unmute yourself straight away. You can just raise your hands. We'll make you a panelist, and then you will be able to basically ask your questions. ये डॉक्टर मधुर को डॉक्टर मधुर CDACH होला. Yes, any questions or any suggestions? There is one question for okay, there is one
Good afternoon,
question.
sir. Sir, we are from Tripura state.
Okay, yes, sir. Please.
Yes, sir. Sir, we have two queries. Queries number one, this format is designed for PSC only, sir, or it is also applicable for the CSC or subdivisional hospital? This is the question number one. And question number two, the format, the PSC level format, it will be applicable for the particular one district. In as a small state, we have numbers of patient movement is there. Like West District of Tripura, number of largest hospital is situated in the West District of Tripura, and NCD patient from Kwai and Shipejala district is coming frequently. So then how we find line listed for this patient coming from the other district? So these two queries there, sir.
Yes, Mr. Vijay, would
Yeah.
you like to take up the
Yeah.
question?
I think CHC and D, I mean, I was not clear about the other district one. I could not hear it, but CHC level data will always also be available.
Okay, fine.
The
Is
other
which
one,
level?
other question I missed in between. Can you please repeat?
Sir, the CSC level data, and I think as well as the sub-district level hospital data also will be there, no, sir?
Yeah.
Okay, that's great. And second, sir, we have some patient migration, means regular level patient migration there within 3 districts, especially West Tripura, CPHC district, and Khoi district. But current, as per SOP, only one means the PSC level data is able to seen by the one of the particular district. But there is a huge patient movement is there. One district, another district. If patient is coming from district A to district B, how district B hospital doctors will be means finding this line listing?
I mean, at the point of generation, generating the report, the patient resides to what district? I mean, that patient would be covered under that jurisdiction.
Hmm. No, but
We
question
are
is,
generating, I mean, this report is static actually, as we earlier told that this is a monthly basis report. It is not live report. So at the time of generating the report, if the patient resides, I mean, the individual is belonging to that particular district, that will be covered under that.
actual the report is generated by the particular district only, now like district
No. Report is already pre-populated. District is simply downloading it.
Okay.
And the
So
report is getting generated on monthly basis.
okay, sir. So, sir, I'm just querying about this the service delivery. Like one patient from A district is coming to the B district, and service delivery is providing by the B district. So B district is able to download the report for of A district.
No, because the patient has already moved to B district, right?
Yes.
So that individual is B district's individual, and he will have, I mean, the district will have access to that individual's details.
Yes. So in that case, B district is also requires the data because patient is moving. Means this is for our state issue. One of the district like West district of Tripura, the huge number of patient is moving from Shipehejala and Khoi district. We have the 3 district just common boundary and adjustments. So access for inter-district facility is required for in that
No,
case.
so sir, I will just answer this question. So one is we are giving this downloadable line list, which can be used by district or state level administrators and by PHC level staff also for following up with patients. But for your migration sort of a scenario that you're presenting, on the portal directly, if the patient from a different district walks into a PHC, which is from district B, PHC in district B can go ahead and search for that patient from district A and do like follow-up activities on that patient. So service delivery doesn't get impacted at all. The immaterial of where the patient is tagged to which village and which district. So on the MO portal, you can still search for patients outside your district also.
Okay. Okay.
Okay.
Thank you.
Hello. Hello. Yeah. Yes, please.
Yes, I am Dr. Manjunath calling from Karnataka State, Davangere district. So you right now we have only option for generating line list of all 5 disease screening only, no, not for enrollment. Those who are enrolled.
This already covers all enrolled individuals. All 30 plus individuals who have been enrolled in the CPHC-NCD system will come in the line list. If they have not been screened,
Okay.
the status for all 5 diseases will show as pending screening.
Yes.
No, ma'am. Actually, what is the practical difficulty is that so there is some duplications, errors, and some name missings of individual enrolled. So now, if we go for screening, we are finding it difficult for the persons who are already enrolled. So we may not get those persons now. So the medical officers, they ask for a line list of enrolled individuals.
Yes,
From
this
0
is
to 100 days.
for enrolled or This is the line list for enrolled 30 plus individuals, Dr. Manjunath. Doesn't
Only
matter
for
whether
30
they're
plus.
only for 30 plus, yes.
And what about others, ma'am? Like 0 to 100 years, whatever.
30 plus actually.
30 plus, like this is based on your population
Not
based
below,
screening
not
program.
below 30. Yeah.
Not below 30, yeah. Because right now the priority is to screen individuals above the age of 30 as under the population based screening program under NPCDCS.
Okay. Okay. Thank you.
There are few questions in the chat box, but I think one of it Akansha has already answered, which is FTP login and FTP file password are different. So yes, they both of them are separate. The next question is CBAC entry of all beneficiaries mandatory for this. So basically, Dr. Rijita is asking is CBAC entry of all beneficiaries is mandatory for generating this line list.
No, so CBAC entry is not mandatory. CBAC entry is mandatory for doing screenings, but anybody who's enrolled and even if CBAC is not filled, that record will come in this line list.
Okay. Then the next question is, do we have separate line list for confirmed patients of hypertension and diabetes or cancer?
As of now, we don't have a separate Excel downloadable line list for confirmed hypertension and diabetes patient list. This list is directly available to clinicians on their application. And this list is also available at the state and district level dashboards.
Then there is one more question that e-hospital application and this app, can it be linked? I think this is e-hospital is probably they're asking about HMIS, hospital based HMIS. So this is a specific request. Maybe if the state requests, we can work on this in the future. Then the next question is, do we have option for generation of line list for individuals enrolled to identify duplication errors and delete?
Yes, so every individual who's above the age of 30 years of age will show up in this line list. So at least duplicate errors and all for 30 plus age group can be addressed using this. And if we have to include data for below 30, that request also we will discuss with the ministry and we can see adding that.
So Dr. Manjunath, this request, there is one more request from our side is like that we should always motivate our primary healthcare team members to generate ABA IDs through this application. Because as of now, the generation is quite low, but once we generate ABA IDs of all the beneficiaries, this duplication and all such options will be basically in the future will be minimized a lot. That's why it is a kind request to always like let's say address our primary healthcare team to start using this ABA ID feature in our application.
Sir, in this line list, please add health ID also, sir. Then they will come to know whose ID they have created, who is pending.
Yes,
It
that is available,
there.
sir. That
It is
ABA
there.
ID is there as a column in the line list.
Thank you.
So there is one more question from Dr. Lalit from Odisha. That need to know the month-wise revisit entry of confirmed patients in application and need to know and need to download the block-wise data for single district of the state. Can it be done? Means basically is asking that whether month-wise entry of confirmed patients in the application and block-wise data of one single district, can it be done through this process which you have explained?
So I think the data that Dr. Lalit is asking for is already available on the dashboards. So you can see your follow-up data. You can put month-wise filters on the dashboard and download that data for district, for subcenter, for PHC. Like we can go down up to village level. You need not use this line listing process to download the data. What Dr. Lalit is asking.
Okay. So I think after that there is a question from SPO Gandhinagar. I think the same the answer to that question also remains the same what Akansha has just addressed, okay, basically the facilities can use that state specific data which is entered. Is this application based only on mobile or can we do it on desktop? So I think it is, yes, Akanksha, I think it runs on desktop, right?
If you're asking about the CPHC-NCD IT system, then yes, like the application for medical officer works on mobile and desktop.
This, what do you say, the process of generating line list.
That is better usable or more on desktop, in fact, right? Because you will download heavy CSV files, which will have thousands of data under each PSC. So that will anyways happen on desktop.
You will also need extraction actually, the 7-zip software you need to install. So it's better to do on desktop.
Yes, so Dr. Sonia, it is always recommended that you use a desktop for this to access this application because the mobile sometimes does not support the features which are required.
Yeah, and no, sorry, just to clarify, Dr. Anwar, so what we are saying is you should use desktop to download this line listing data using FTP server, what was covered in the orientation today. But otherwise, CPHC NCD application can be used on mobile or desktop. Like the actual MO application or PHC application, that can be used on mobile or desktop.
So Dr. Girish is then asking he's from PHC. He's asking, is this list editable?
So this list is editable, but the process that we showed right now, this is an output of the data which was entered in the CPHC NCD system. If you want to edit any details, so for example, if against a record you see that the ABHA ID has not been generated, so to take action on it, which is to generate that ABHA ID, you will go back to the NCD application, search for that record, and then do the processes in the application. So the patient information, if you want to edit, if you want to do screenings and all, everything for that, you will have to go back and do that action in the NCD application. This list only sort of gives you an output of all the data which is entered in the system so far and allows you to sort of track and follow up cases who have not been screened, where ABHA ID has not been generated.
Okay. Then Dr. Lalit is asking again that he wants to have that information of revisits of the patient whose entry is not done. So how can we see it? Means basically the follow-up visits of the patient. If I'm not wrong, Dr. Lalit.
Yeah, so this information is again available on the NCD application, not in this downloaded line listing, because this download line listing through FTP right now has limited fields for like it has some demographic data, ABHA ID, and then screening status. So for follow-up, again, that information is available in the application or through dashboards. And maybe we can reach out and speak with Dr. Lalit later if there's any other specific request that they are asking for.
Sure. Then state NCD cell Rajasthan is asking for a filter for downloading the data month-wise.
Okay, so right now, like the data will be updated on a monthly basis and it will always have cumulative data. So like first of every month, for example, you will get the all the line list of patients who've been enrolled under that PHC or under that district. Right now, through this FTP folder process, we do not have a provision for adding date filters. Once we add it to our regular NCD dashboard, we will look at ways of how we can add that date filters.
Okay. And I think from NCD Haveri, it is much more of systemic suggestion. They are asking to create a simple app with a single with a combined interface for ASHA, ANM, and MO. So, sir, will definitely look into it and we'll work on it to create one interface, and we'll see how it goes on. Then,
But again, sorry, just to also address the concern from NCD Haveri, So, sir, this CPHC-NCD system is a single platform. It is a single technology system which has multiple user interfaces. So, what you are saying, this is the current construct also. So, it is a single backend, it is a single platform, and we have multiple user interfaces for ASHA, ANM, and MO.
Then Dr. Girish from PHC is again asking PHC password same for will it remain same for desktop and application board, means mobile application board, the password for opening the line list.
Yes. For PHC, it is for line list. No, I think he's asking for the CPHC-NCD app. If you're asking, sir, for the CPHC-NCD app, then the password is same for using the app on desktop or mobile.
Okay. Priority was given last year to enroll above 30 plus population. Now we are enrolling below 30 plus population. But if I start adding to the family folder will not appear. Basically, it's not showing if the because they are enrolling the people who are below 30 years of age.
My understanding is, Dr. Anwar, the request is to include individuals who below the age of 30 also in this line list.
Years, yes.
Yes. We can take that. The idea to right now prioritize and give this 30 plus line list was because otherwise the Excel file will also be quite heavy. So we will see, we will take this request back to the ministry and evaluate if we can include below 30 individuals also.
Then there is one more suggestion regarding ABHA. Okay, for ABHA maximum benefit, like majority of the beneficiaries do not have their Aadhaar number linked to their phone number. So that's why it's creating a lot of issues in generating the ABHA ID.
Yes, I think Dr. Manjunath, we have also heard this feedback from the field, and we have also taken it back to National Health Authority to see if they can change this process in some way. We are yet to sort of get a response back from NHA. But again, Aadhaar generation using Aadhaar is right now like a mandate given by NHA and agreed by the ministry.
Okay, so even the same answer stays for Dr. A.V. Patil as well, because his concern was also same regarding linking the health ID, because the OTP KYC is doing some issues. So definitely, sir, we are working on ways so that the ABHA IDs can be generated much more efficiently.
Yes, we are also working on this biometric KYC, sir. Maybe in couple of months, we can provide an update.
The biometric KYC, the staff on mobile number. Yes, sir, Dr. A.V. Patil, we are working on it, and probably we'll get intimation very soon about this biometrics as well. There is, I think, one last question that PHC, CHC, and district level patients search by ABHA ID so that they can get the name. Means basically they are saying the search option through ABHA ID to search the patient. Search by ABHA ID.
Yes, this is again already available on the NCD application. So search using ABHA ID on the PHC or CHCDH application on desktop or mobile.
The feature is already there, sir, in the application. Apart from it, I don't see any more questions in the chat box. If anyone have any questions or any suggestions, any feedbacks, then we'll be more than happy to address. Okay, one more question came in. What we will do for the previously entered individual? Do we need to re-enter it or not in the family case? Yeah, so basically the question is he's asking about the revisits, the people who are visiting again, what do they need to do? Means they need to re-enter the individual again, means they need to parallelly create a new record for the patient. And even in case of CBAC, if the CBAC of the person is already filled and is in the next year is undergoing the CBAC again, do we need to re-enter and update that the same CBAC which was filled before? So Akansha, you can address this question.
So I'll just provide my understanding. So what happens is, if you've enrolled an individual once, this is a one-time activity. Once I've enrolled, that creates a longitudinal record for that individual. that you can use to track his entire lifetime. So let's say in 2022, I filled a CBAC for that individual. In 2023, if I have to fill CBAC again, then I should search for that same individual using a unique ID, which we are saying to suggesting to generate ABHA ID so that the regular search also is easier. So once you search for that same individual, you don't need to re-enroll again. You can only open the CBAC and re-enter only the CBAC information. So enrollment required to be done only once.
Now there is one more question. IHCI and CPHC-NCD is merging. So, sir, probably I don't think this is the right platform to address this question, but we are definitely working on it to merge both the systems and create a unified system so that basically the data entry fields can be reduced. And I would like to make one more announcement in this regard, that in all the states, wherever the IHCI is implemented, we are planning to have one more meeting, that is on 15th, day after tomorrow, 15th of September. So you will receive an email intimation very soon. So that meeting is exclusively for the states where IHCI is being implemented. In that meeting, we'll be discussing the transition plan between simple application and CPHC-NCD application. So, sir, your question regarding this merging and all those things between IHCI and CPHC-NCD will be addressed there itself. After that, there are just suggestions regarding OTP generation issues which are there for users, which is slowing down the process. And there is one more suggestion: need to add auto generation monthly reports in NCD portal to reduce the burden of manual report. So basically, sir is saying that auto generation feature should be enabled in the system itself, so that the reports need not be generated manually, and it will also help them in maintaining the registers, basically the hard copy.
Yeah, sure, Dr. Anwar. I think I think Dr. Patel is referring to the NPCDCS reports, monthly reports.
Okay, so I think that's it. We are well on time. I would like to, let's see, there is one more suggestion, that disease-wide line list should be downloaded for the whole district. So they are requesting if the disease-wide line list can also be generated in the future.
Okay. I've noted down the request, Dr.
All the requests and suggestions we have already noted down. Thank you. Thanks a lot, everyone. I would like to request Dell team to even post their the support email address, so all the suggestions regarding their application can be sent to that email address. I would like to thank all the state teams, all the state nodal officers of CPHC, CP, our NCD nodal officers, state consultant, district nodal officers, and even our PHC medical officers for diligently attending the meeting and basically giving us a very good suggestions on improvement on the improvement of our system. I would also like to thank Mr. Vijay Sharma from Tata Trust, Akansha from Dell, Mr. Karthik from Dell, and Miss Anamika from Dell for their for a very good facilitation of this session. So with this, I think we should officially close this session. If there are any suggestions, you can always get back to us in the future. Thanks a lot for your patient listening.
Thank you all.
Thank you, everyone.
So the video is still available on the YouTube. It will always be there on the NHSRC channel. Whoever wants to listen to the videos to this orientation can go back to the YouTube and always refer to this orientation in the future.